and welcome to Mountain Health Today, a program brought to you by the Tahoe Forest Health System. We try to cover all kinds of topics, healthcare related, things that are of interest to you and me in the community. Today we'll be talking with Maria Martin about community health and the wellness neighborhood. We'll be back in just a moment.
Hi, my name is Maria Martin. I'm the Director of Community Health and Wellness Neighborhood and Care Coordination for Tahoe Forest Health System in Truckee, California. The Wellness Neighborhood is Tahoe Forest's strategy for improving community health. We use different strategies in that to help prevent disease from occurring, so disease prevention strategies, self-management strategies. We help people with chronic disease better manage their diseases. So some of the things that we do is we implement chronic disease and diabetes self-management classes that are offered free to the community, 6-week series that are based off of Stanford University's model of self-management. We have health coaches that help support people to reach their goals. We have dietitians who help people make changes in how they eat and identify things that will work for them in their situation. The Wellness Neighborhood also looks at things more community-wide, and we do a lot of programming with our local school district, trying to reach children, help them develop healthy habits that will last a lifetime. Some of the examples of programs that the Wellness Neighborhood does in our local school district are a Harvest of the Month program, where we do a monthly fruit and vegetable tasting of an in-season California grown fruit or vegetable. We use a lot of parent volunteers to implement the nutrition lessons and tastings in the classroom. We also do an activity and wellness intervention called Be Fit, which promotes activity breaks in the classroom and then also educates the kids on a monthly wellness theme, which could be stress management or dental health or a variety of other different topics. One example of how we've expanded community participation is with our dental outreach program. We are doing dental varnish screenings in our local school district for preschool and kindergarten classes, and we've been able to get participation from local dentists in helping with these events. One of the priorities of the Wellness Neighborhood is access to care and care coordination. And care coordination is where we provide more one-on-one support with people that are experiencing different health issues. Some of our care coordinators work with Medicare patients who have 2 or more chronic diseases and need more one-on-one support to help them be healthy. We also have a care coordinator that works with total joint replacement patients, and we have another care coordinator that works with our perinatal patients, so pregnant women during their pregnancy and after that may have higher needs. You can learn more about what the Wellness Neighborhood does by checking out our website at tfhd.com and look for Wellness.
Welcome back to Mountain Health Today. I'm Ted Owens, your host, and I'm with Maria Martin from the Wellness Neighborhood and Director of Community Health for the Tahoe Forest Health System. Maria, we left off talking about chronic disease self-management, and that involves a lot of partnerships. That program. Why don't you share with me a little bit about that?
Yeah, one of the things that we've done with chronic disease self-management, we have a really strong partnership with our 2 family resource centers. One's in Truckee and one's in Kings Beach, North Tahoe Family Resource Center. And with leading these chronic disease self-management classes that we offer through Stanford, we've worked with the family resource centers to train leaders to help train other leaders. We offer the classes in English and in Spanish, and between the 3 agencies, the hospital and the 2 family resource centers, we can offer classes throughout the region to a variety of community members.
Okay, so you have a lot of other partners, I would imagine, with other programs within the Wellness Neighborhood. Beyond the resource centers, who would they be?
Yeah, so when we did when we kind of established the Wellness Neighborhood after the Community Health Needs Assessment, we brought together a lot of the different agencies that are working in similar areas. And what we found is that by having these strong partnerships, we can reach more people, but we can also be more efficient, and by working together with many of the different agencies. So we work with the agencies of the Community Collaborative, which is a lot of different social service agencies, there's many to mention, such as Tahoe Future Without Drug Dependency, Tahoe Safe Alliance, Truckee Healthy Babies. Those are many small partnerships there, but one of our larger partners is also the Tahoe Truckee Unified School District.
Okay, and what about the counties?
Oh, and Placer and Nevada County, right. We work with both of those health departments.
Anything in Washoe?
We do a little bit in Washoe, not as much with Washoe County.
So that helps you reach a broad range of people in the community. You already talked about the bilingual capabilities of doing that. Do you feel like these programs and that work is moving the needle with certain demographics within the community? Are you seeing success?
I think it has. We are seeing success. It's really hard to measure change, and what we're hoping community-wide change, and which is one of the reasons why we did the community health needs assessment. Again, we're doing it every 3 years because we can see from that if there's slight movements. Making lasting behavioral change and having that impact health, it's a longer process.
You had mentioned the school district is a very big and important partner. Tell me a little bit about that, because I would imagine you're trying to create good habits with young kids. Is that really the goal?
Exactly.
And then does that translate into the family?
Improved health.
In total?
Well, that too, right. So we spend a lot of energy in the school district because being health promotion and disease prevention, we really want to start with people as young as possible to set those healthy habits and healthy preferences when they're just starting. So we have programs in preschools. We do a lot. One of our most successful programs that we've been in place for this will be our 10th or 11th year, is the Harvest of the Month program. And that's a nutrition education and fresh fruit and vegetable tasting program that we do in all the classrooms in the district, including Incline Elementary and several charter schools in the area.
Where children bring that home, right?
They do, and we use parent volunteers that we train to lead the classes. The kids bring the information home, and what we find is that when kids are tasting foods, new or things that they've seen before, in their classroom with their peers, they're more receptive to trying new things, and they get excited about trying healthy fruits and vegetables.
I think you're really onto something, because I'm still scarred by Brussels sprouts and broccoli, the way they were introduced to me in my generation.
Well, you'll find that with that, we have parents that will email me saying that I serve broccoli all the time, but because Johnny tasted broccoli in Mrs. Smith's class,
it's a must.
now it's okay.
Very good. Let's talk about Rethink Healthy, and briefly explain to me what that is and what benefits exist there.
Yeah, so Rethink Healthy is kind of like our tagline, and that's like what we call our health promotion and wellness events. And I shouldn't say it's more than just events. It's sometimes we go to community events and we have booths and we provide information, or we do health screenings, or we write articles. And we offer different classes too. That's all kind of part of what Rethink Healthy is.
And how do you populate that? Is it just strictly staff? Do you have volunteers, or what does it look like? That's a lot of work you're doing in the community.
It is a lot of work, and most of it is really from our staff. We have a really great core team of professionals that are working in many areas in the community.
So we talked about kids, and they're receptive, right? You know, they're malleable and you can mold them. But adults are set in patterns. So in your outreach, do you feel that you're making a difference? Have you been able to see adults with willingness to change and to do things differently? And if so, in what area? What's the biggest improvement?
Well, in this portion of the wellness neighborhood, I would say that the adults that we reach the most are with our chronic disease self-management classes. And we definitely see positive experience from that. This year we also started a diabetes prevention program, and that's also to adults. That's a big commitment for people, and it's identifying people who are at risk for a disease but who do not have it at this point. And it's a long-term making lasting lifestyle changes through that program.
That could be diet, could be
it's diet and exercise,
alcohol,
yeah.
It could be smoking cessation.
We have a great kick nicotine program that actually the provider that's teaching that class is using some really new, interesting mindfulness strategies, and is seeing really great success with people that are ready to quit smoking.
It's not just smoking. There's smokeless tobacco too.
Smokeless
so do you have
tobacco.
some folks that come in from that category?
You know, actually, I don't know if she has any had that yet, but the strategies that she uses with it would work for that too.
Okay, that's fascinating stuff. And how often are you active in the community with that program?
Oh, it's ongoing.
Ongoing.
It's ongoing. You can learn more about our Kick Nicotine program by just checking out our website,
TFHD.com.
and go to Wellness Neighborhood.
Okay, well, we're going to come back in just a moment because we're running out of time. We have another segment, but for the folks at home, you're watching Mountain Health Today. We're having a very interesting conversation with Maria Martin about all things healthy and your community health. We'll be back in just a moment. Welcome back to Mountain Health Today. I'm Ted Owens. We're talking with Maria Martin about the wellness neighbor and community health issues. Maria, we left off at probably a good point there, talking about Rethink Healthy and all of those things. Let's talk about programs for a moment. And one thing that I'm interested in is community health screenings and labs. But how do you reach folks? How do they access you for screenings?
Well, for screenings, we try to make ourselves available at different areas in the community. If there's a community event, an employer benefits fair, we're always at the Truckee Air Show, where we'll do some screenings.
You guys at the air show, you were slammed.
We were popular because we had water at the air show, and it was a really hot day. Yeah.
I even went in and found out my blood pressure was a little elevated.
Yeah, so that's a good event. So at the air show, we provide information about our services. We do blood pressure screenings, which is one of the things we've been doing a lot of lately in the community because we have a grant around that. We had water bottles that we were giving away, and we had kids at tables decorating the water bottles and then filling them up with our spa water, our ice cold spa water.
We also had sunscreen.
We had sunscreen and lip balm.
And I know you've been at the 4th of July parades, participating in things like cleanup days and all kinds of things. Also block parties with other governmental agencies you've been involved with there. Now, do those, okay, that's great for screening. That's great for blood pressure. It's great for, some face-to-face time. What about lab?
So one of the things that we offer that's really popular is we offer affordable labs. And being up here in a rural area, sometimes it's hard for people to get down to Reno to a lab corp or something like that where you can get your labs done at an affordable price. So we offer a monthly affordable lab in Truckee and in Glen Village.
And how do people find out about that? On the website?
You can find out about affordable labs on the website. We make a schedule for the year. It's in the local paper. And you should be on our Facebook page too, because we talk about it there too.
Social media. Let's talk a little bit about Heart to Heart and your weekly lectures.
Yeah. So Heart to Heart.
Where do you do them, and how often do you do those?
Well, Heart to Heart is a program that's grown out of our cardiac rehabilitation department. So it's in the hospital and it's in the Eskridge conference room. And every Thursday we have.
Now that's just for the folks that are watching, that's on the Truckee campus?
Yes.
Okay.
It is. And so every Thursday there is a free lecture that's on a variety of different topics, and that's another thing that you can find out on our website. But it's open to the public. It's not just for patients that are in the cardiac rehab program, but the things that we cover in this class are really applicable to anybody who's looking at, like you were saying, like, I need to maybe embark on some lifestyle change. So there's classes on nutrition, there's classes on exercise, stress management, etc.
Now you can't do all this. Tell me about the folks that provide the lecture, that do the talking. Who do you bring in?
We bring in different members of our team that are experts in these areas. We have exercise physiologists, we have registered dietitians, we have mindfulness instructors that work on stress management. We have a really great team.
I should attend. Okay.
And we also do monthly community talks. It's pretty much almost every month. And those sometimes they're in Incline and sometimes they're in Truckee. And we call them Rethink Healthy talks on a variety of different topics that maybe appeal to people.
Do you get input from folks, perhaps from social media, about potential topics that the community might be interested in?
We do take, yes, actually we do. We get input from different people in the community, what they want to learn more about. about, and we try and find an instructor to lead it, or sometimes it'll be someone that says, hey, I've got a great idea, and we can test how these are by the number of people that attend. Dr. Koch just did a recent talk on advanced care planning in Incline, which was very well attended.
Well, that's excellent. One thing I know that's a problem, from my days at the county also was dental health. And dental health can really, poor dental health can lead to people ending up in the care of the health system. So tell me about the Dental Coalition, and is there progress being made in better dental health?
Yeah, and actually this is a really area of high need for our community, and it's been identified in all the community health needs assessment. There's not a lot of access to dental care for people that don't have dental insurance, and so what we decided to do is we put together a coalition of dental providers, a pediatrician, the school nurses, some members of our wellness team, to look at the issues and figure out how could we address this problem in a preventive fashion. And so what we've been doing is we've been really targeting youth and using some materials cavity-free at 3, and that's our goal. Is we want all our kids to be cavity-free by the time they get to their 3rd birthday, because if they can be cavity-free by then, they're in a much better place to have good dental health for the rest of their life. Is that because of the habit of dental care strictly, or is there something else to it? It's part of it. Dental care is brushing your teeth, right? It's getting regular exams, and we are lived in an area where we don't have fluoridated water supply, and so a dental fluoride varnish is very protective for preventing cavities too. So with our dental coalition, we do screenings for youth, site-based screenings at schools. We also work with our pediatricians to offer some fluoride varnish in the pediatrician's office, because we found that people see their pediatricians regularly for regular well checks, but they may not be seeing a dentist regularly. And good habits starting early makes a bit of a difference. I know we talked earlier, you do a lot of work in the schools and school-based programs and BFIT and youth care navigation and what have you. Does that go all the way K through 12? They're targeted at different areas. So Harvest of the Month is K through 8th grade at some schools. The BFIT is K through 5th. And the Youth Health Navigator that you mentioned, that's really a high school targeted program. We might be expanding that to middle school. Well, you're doing quite a lot. I think it's important before we go to talk a little bit about how people can access. We have the website, tfhd.com, and you have a customer care navigator, a phone number, I believe? We do. We have navigators that are answering the phone. Someone's answering the phone 7 days a week, and it's at 587-3769. If you've got a question about 530 area code. 530 area code, that's correct, 587-3769. But if you have a question about something that I've talked about, or you want to learn more information about a program, that's the number to call, because you'll get a friendly voice that will talk to you to find out what might be appropriate for you. Well, Maria, thank you very much for joining us today, and great information, good work. I really appreciate your time. Thank you folks for watching Mountain Health today. We've been spending time with Maria Martin on community health in the wellness neighborhood, and we'll be back in just a moment. Thank you for watching Mountain Health Today, brought to you by the Tahoe Forest Health System. I'm your host, Ted Owens. I'd like to thank Maria Martin from the Wellness Neighborhood, talking about community health. We hope you've enjoyed your time with us. Maria, thank you, and we'll see you on another episode soon.